Hi, this is Beth Barfield, and I am doing my video in regards to PO and IM medication. First thing we're going to do is we're going to identify that we have to follow the 6 rights of medications when giving our patients meds. It's the right patient, the right medication, the right dosage, the right time, the right route, and last but not least, the right documentation. You also want to do your 3 checks when you're giving any medication. You do your first check when you're checking your MAR, you do your second check when you're preparing it, and then you do the 3rd check when you are at the patient's bedside actually giving the medication. By doing this, you have checked at least 3 times that you are giving the patient the correct medication at the right time. So with Miss Millie Larson, we checked her MAR, and I'm using an electronic MAR because I'm currently at a hotel. I'm on a travel assignment, so I've had to kind of go with the flow. When I do my thing, I'm also gonna act like I'm wearing gloves. Unfortunately, my gloves were not in my bag, but I will do the entire procedure. So when looking at Millie Larson's MAR, I'm checking it. I'm seeing that it's Miss Millie Larson. Her date of birth is 1/1/36, and she has no known allergies. She has 2 medications that we are giving her at this time. The first is the Practi-Docusate 100 milligrams to be given by mouth at this time. The medication does expire on 10/23. The second and that is this medication that is right here. The second medication we are giving is the Practica haloperidol. This is an IM injection, and according to the medication, our dosage is for 2 milligrams to go IM or intramuscular in the ventrogluteal. This bottle has the 5 milligrams with the 5 ml, so it would be 0.4 mLs that we would be giving. When looking on here, the expiration date is 6/2029, so we know of that. I have my medicine cup. I have my water. I have my alcohol swabs. I have my tape, which I've already sectioned 2 pieces off. The first tape will be sectioned for when we give to labeling the syringe. The second one will be when we put the 2x2 gauze on the patient after the injection. I have my little injection pad, which is going to duplicate for the patient's body part when I do the injection. So now we're going to prepare the medication. I have pulled it's normally from a Pyxis or a Nexus, the Practi-Docusate, the 100 milligrams, double checking it once again. We're going to now prepare the IV. Or not the IV, the IM injection. So first thing I'm going to do is I'm going to wash my hands. I've got my lovely wipe, and I'm also going to put on my gloves. Then I'm going to prepare it. I'm going to take this. I'm going to take my alcohol. Of course, I'm rubbing it to make sure, keeping it sterile. Then uncap. I am using a 23. 23 is pretty much 23 or 22 is pretty much a standard size. When I worked in the hospitals, 23 is the basic standard size that you would use for giving an injection. The 25 is a very small needle, and I'm also using a 3 ml syringe. The 25 is a small needle, and when you're trying to get into a muscle, it's very hard to do. Not that you can't do it, but it's hard. I know with some medications like Ativan, things like that, they're very thick, so you need a bigger needle to be able to get the medication out. So first thing I'm going to do is I've got my air. Then I'm going to draw up. Put my air in. Now I'm going to draw up. Okay. Oop, that made a mess. I've got my four mLs. I'm going to do my scoop. I scooped it. You can either use the safety or use the scoop. They prefer you not to use the scoop. They prefer you to use the safety, but I've just gotten so used to doing that but it is safe and secure. So then I'm going to mark on my tape what the medication is. So this would be 2 milligrams of haloperidol. I'm going to wrap that around my needle, around my syringe. We do this because we want to be able to identify, especially if you have multiple syringes, you want to be able to identify what you are giving to the patient. You don't want to be giving a medication if you don't know what it is. So next thing we're going to do is I'm going to take off my gloves and I'm going to wash my hands. Then we're going to go into the patient's room. We're going to knock on the door, introduce ourselves. I'm Miss Larson. My name is Beth. I am your nurse. Can you identify yourself? Give me your name and your date of birth. She'll say, my name is Melanie Larson. My date of birth is 1/1/36. You can also verify it by her bracelet. Most patients nowadays in the hospitals, the bracelets are plastic and they have their names, their date of birth written on there. That's the easiest way to identify who your patient is while they're in the bed. Then you're going to explain what you're doing. So, Ms. Larson, I'm going to be giving you 2 medications. One medication is going to be by mouth. It is the Practi DocuSate. It is for helping you with bowel movements. When you do that, I always open. So I'm going to, before I give the medications, I'm going to wash my hands. I'm going to put on my gloves. A lot of times I found I have difficulties opening these. So if you have a glove in your hand, and just pretend you do touch the medication, it's not going to contaminate it. So I'm going to wash my hands, put on my gloves. Then I'm going to pour the medication. See, this is what I'm talking about. I always have issues with this, so that's why I go ahead and that's why I have my gloves on. So here is my Practi DocuSate. The second medication we're going to give you is Practi haloperidol. This is it helps with agitation and also helps to relax you. This medication is going to be given IM, which is in the muscle, intramuscular. So we're going to give it in a spot, an area called the ventrogluteal. So what I'm going to have you do is, if you could please lay on your side. I'm going to put my hand on the palm of the femur. And then I'm going to spread my index finger and my middle finger into a V. My index finger is going to go along the anterior iliac crest with the end, and in the middle is where I will be giving the injection. So I'm going to wash my hands. I'm going to prepare my gloves. Put on my gloves. Then I am going to wipe, insert. We're going to wipe with the alcohol, going from in to out. I've got my little injection. I've already did that. With my non-dominant hand, I'm going to make sure the skin is taut. So I already have my area. Of course, it's a little hard to see. So I have my area. I'm going to top. Let's see if I can do this. All right, I'm going to top the skin, and I'm going to go in at a 90-degree angle. So here we go. Actually, I think just for visualization, this would not actually happen. Okay, put this down here. Perfect. Now everybody see. I would taut the skin. Then I'm going to put this in. Then I would aspirate to make sure that there is no blood, 3 to 5 seconds, and then I would inject in. I'm going to pull it out. Woo. Then, of course, the medication wouldn't be flying. Then I would cap it. I would put my 2x2 on the patient, holding pressure. And then I would put a piece of tape. There we go. So, sorry for some of the edits. Like I said, I've had to compromise. And then all of my my injection, my needle would go into my sharps container. Then my medication and everything else would go into the empty medicine bottle, my empty water bottle, everything else would go into the trash. Then finally I would document. So I would document that the patient, and most of the time it's a click, and you would document, okay, you gave the medication at the time, you gave the medication at the time, and then usually there's a drop down button. I know with Cerner or with a lot of the other charting systems, when you document that you're giving an IM medication, there's usually a drop down, so you drop down and put right ventral gluteal for the area. And then you can also document in your notes if you're not doing it that way. If you're just clicking and then you want to put in a nurse's note, you put in a nurse's note that you gave the injection, where you gave it, right ventral gluteal, that there was no signs of no bleeding or limited bleeding, that the patient tolerated the injection without issue, and that would be it. If it was a pain type of medication, then you would document after about 15 to 20 minutes, that you give the medication, it was well tolerated, and then about 15-20 minutes later, you'd go and you document that the medication was given and the patient tolerated it well, and that the pain subsided or temperature decreased, whatever you were given it for. All right, thank you very much.